I'm Dr. Khullar and I'm a board-certified pediatrician. I was diagnosed with COVID-19 a few weeks ago and I wanted to talk to you guys about how I managed my symptoms at home. Before considering any of these management styles, please discuss them with your own primary care physician. Reasons to seek immediate medical attention would be shortness of breath, chest pain, blue-gray discoloration of your lips or your nails, and dehydration. So the day that I had experienced my symptoms, I had woke up, I was on my way to drop my son to his school, and after that, on my way to work, I had to turn around the car and go back home, which I never do. And when I got home, I was experiencing a lot more of the symptoms for headache and sore throat and some shortness of breath, and I thought that maybe this is something like a cold that was just exacerbating my asthma, which is one of my medical history. So I thought, okay, let me take my inhaler. I'm gonna just drink some warm tea and I'm going to get some rest and I'll be fine. The first day went by. After the second day, it was very similar, except my heart rate was elevated because I was taking my inhaler for my asthma quite often on that second day. I also have anxiety as well, so that didn't help the situation. A lot of my shortness of breath and chest pain were worsening. The third day, when I woke up and my symptoms had not improved, in fact, they had worsened. I had started wheezing at that point. I felt very weak, very difficult for me to get out of bed, is when I decided, okay, I have to consult my own physician. I had called her up and she did a telemedicine visit with me. I told her my pulse ox, I told her my heart rate, I told her the symptoms that I had, and she told me, okay, I want you to go to the local urgent care and get a rapid COVID test done, which I had done, and it was positive. And she had suggested that she wants me to go to the hospital to get an infusion of monoclonal antibodies. Monoclonal antibodies are something that's given not when you're on any supplemental oxygen, it's before that point, and it's something that helps build antibodies. It's a laboratory made antibodies that mimics the immune system's ability to fight viral antigens. You usually get this infusion if you are over the age of 65, which I am not, or you have a medical history. So I do have asthma, and for that reason I qualified to get this infusion. She did not want the severity of my symptoms to worsen after a couple of days. She had sent a few other patients successfully, which had stopped the symptoms. After a day or two of the infusion, she suggested that for me as well. So when I showed up at the hospital, I had gotten the infusion and it was over a course of an hour. I had no symptoms afterwards, and they do keep you in the hospital for an hour or two just to make sure that you have no allergic reactions and your vitals are stable after the infusion is completed. After I had gotten the infusion and I stayed at the hospital for a few hours, I was sent home, or I was discharged. When I got home is when I had to quarantine myself for 10 days. You're supposed to quarantine yourself from the first day of your symptoms, 10 days after, or from the first day of your positive test result if you have no symptoms. Luckily, I stay by myself, so I had not affected anybody in around me. For people who live in a household with other family members, you should isolate in a room. It should be a well-ventilated room. If you do share the bathroom, you'd want to sanitize the bathroom in between of usages. When I came home is when I had to go through many different symptoms that I did not know about, and I did try a few different remedies which I wanted to share with you guys. There are 13 of them, and don't ask me why, but here we go. So number one, I would definitely consult your own physician on the first or the second day of your symptoms or positive results. Many adults that I know don't have a primary care physician, and they are the ones that will know your medical history to know your severity, or to know whether there's something that you need to look out for in particular before seeking further medical attention. So I definitely recommend that you consult with your own physician. Many people tell me that you are a physician yourself, shouldn't you be knowing what exactly to do? Well, for those of you that don't know, we are our worst patient. We try to do the least possible and try to be as strong as possible without doing any sort of management or seeking any other medical attention because we think we can manage it on our own or it'll get better in a day or two, which may not be the case. When you are sick, you do need to seek medical attention because you're just not able to think clearly. So definitely consult your own physician. Number two, you want to make sure that you have a pulse ox at home. So it would look like this, and you want to make sure your finger fits in the pulse ox. And when you do check it, you want to make sure it's on a stable surface and there's no temperature irregularity of your fingers, because sometimes when it's very cold, it's not going to read properly. Something that you could use to monitor your oxygenation at home, especially if you have any lung conditions, and you want to make sure that your pulse ox is reading over 95. 95 to 100 is normal oxygenation reading. If you get a consistent reading lower than that, that is something that you need to call your primary for. The other thing that you should monitor is your temperature. That way you would have a log of it, of your highest to lowest. That way, if you do need to seek any other further attention, you can definitely provide that information. The third thing would be that you want to make sure your diet is up to par, and it's difficult because you're in bed and you don't feel like getting up or making anything, but try as hard as you can. Get the help of family members or friends to drop stuff off to you if you don't have anybody in your house, so that way you can get some home cooked meals, you can get your medications delivered to you, and that way you can eat some good nutritious meals. You want to make sure your fluid intake is high, you're drinking lots of water and electrolytes. I did drink a lot of coconut water, which is great for your electrolytes. I did have a lot of soups and broth, and lentil soup is really good for you. Chicken noodle soup, of course, is really good for you. You can make it with different ingredients. You can put things like ginger or garlic in it, which is really great for your immune system, and it's going to help with any sort of inflammatory response that your body may have. Number 4, you want to make sure that you decrease your caffeine. Caffeine is something that I love and I can't do without, but it does increase your heart rate. For that reason, it was difficult for me to drink the caffeine, because with the anxiety, once again, my heart rate was up, and because of the inhalers that I was taking, my heart rate was up. If you drink more caffeine, not only is it dehydrating, but it's also going to affect your heart rate. So instead, you want to drink a lot more just regular water, or if you have to drink the decaf tea, you can also add ginger to it. You can add a little bit of lime or lemon for that vitamin C component, and some honey, which is very soothing for your throat. Number 5, for body aches, you want to make sure that you take Tylenol or acetaminophen. If you have no other medical history and you have no other GI issues, you could also take ibuprofen, which is definitely going to help you with those body aches that you get, so you can get up and move around a little bit, because it is important for you to get up and move around, so that way you get your lymphatics moving a little bit and you get some oxygenation flowing throughout your body. Number 6, you want to make sure you sleep and get some rest. We do have a lot of housework to do. We have a lot of work that we had to catch up on, and I thought maybe I could do some stuff on the computer, maybe I can get some reading done, maybe I can clean some rooms while I'm here quarantined. I was not able to do any of that. I was that fatigued, that tired. And it's very important to kind of just put that stuff aside and just lie in bed, just rest and get that quality care. The better rest you get, the better your immune system's gonna kick up and fight this virus. So it's very important that you get that sleep and you get that rest. One recommendation for people who are having some respiratory symptoms is that I slept on my belly, which really helped take off the pressure for my lungs, so I can inhale deeply and not have that lung compressed in the back. So sleeping on the belly did help me at nighttime, so my respiratory symptoms did not worsen. Number 7, I would definitely try some deep breathing exercises for those who are having some trouble with the shortness of breath or with breathing difficulty. I did feel the shortness of breath for about a week after my symptoms started, and that was very unusual because that had never happened before. I had a very difficult time even holding a conversation on the phone. I clearly remember that, and it was a little frightening that that was happening, so that's why the pulse ox was important. There's a few exercises that I looked up that were really helpful to do in the morning, in the evening, to kind of help with your lung functioning and your strengthening your diaphragm, and also helping with your heart rate if you have anxiety. The first exercise was pursed lip breathing, which is that you breathe in for 3 seconds like this and breathe out with pursed lips. The second exercise that I did was I took a balloon and I paused for a few seconds and I blew out into the balloon for 3 to 4 seconds, and then paused and blew out for 3 to 4 seconds. Besides having a party at the end of that, it really helps with, again, like we said, improving your lung function. The third breathing exercise was breathing in for 3, holding for 4, and breathing out for 5. That really helped my anxiety. That in turn helped my shortness of breath as well. So that's something that I would use for patients who have the shortness of breath and the lung symptoms. This is number 8. Although there's no evidence of gargling and steaming, I did use a plug-in steamer, the ones on the stove. I have to mention there are burn risks, so you can't use it without a parent or an adult, of course, with supervision if you even want to do that. But I did use the steam and I did gargle with salt and warm water, and that did help with the swelling I had in the back of my throat. I felt the steam did help with loosening up some congestion that was around my sinuses or giving me a headache, and it did help with my mucus as well too. So I do recommend both of them. Neither of those, like I mentioned, have been studied or shown to help with COVID-19 symptoms, but for me particularly, it did help. Number 9 is optimizing your vitamin intake. So that would be vitamin C, vitamin D, and zinc. You want to consult your physician to see what dosages that would be appropriate for you to take. But that's something that, of course, would help you strengthen your immune system to fight the virus. Number 10 was for the cough, taking some over-the-counter cough medications. I didn't want to take any cough medications that would worsen my heart rate, so I actually took Colts Neck, which has the ingredient guanfacine in it, which is very helpful for thinning out the mucus in your lung and also helps with your sinus cold as well. It's a cough expectorant instead of a cough suppressant, and I thought because of my symptoms that would be more beneficial, and I have to say that did help quite a bit. Number 11, I do recommend for your own mental health, making sure that you're talking to people on the phone that uplift your mood and add positivity. You want to watch any kind of comedy shows. If you like praying, listen to prayers or some Zen music. A lot of the times, a lot of the things that we have, that our body experiences, could be worsened with our mental well-being as well. Lastly, I want to make sure that you guys have or call upon your friends, your family, your neighbors for any kind of help, and don't feel afraid to do that. The time when I had it, I had snowed and I wasn't able to leave the house, so my neighbor did help me out with getting my medications from the pharmacy. My dad did drop off some food to the front of my door, which was all home cooked, and I love him for that. So that was very helpful to make sure that you're staying in touch with other members around you and that you're getting their help, so that way you can get through this. I hope this video has helped somebody. If you like this video, please like and subscribe our video. And if you have any other questions, we'd love to hear from you. Thank you so much for listening. Bye.